Over the head jump pass to Mason Plumlee to Smith for another three. How sweet it is!
I'm here at Duke University, my undergraduate alma mater, but also home to the top D1 men's basketball team. Under Coach Krzyzewski, the Blue Devils have appeared in 15 Final Fours, 10 national championships, and have won 4 NCAA titles. It's a game of quick stops and starts, and it puts an enormous strain on the musculoskeletal system. So we're standing here on center court. A lot of people think this is where the game starts, but really the game starts well before they get to center court.
Right, these guys are here 4 hours before so they can be ready for tip-off. You want to go see the training room?
Absolutely. So let's talk about the most common injuries that you see.
So we see everything here from ankle sprains, knee sprains, even up to ACL tears.
So this is your basic ankle tape job. These next strips are called heel locks. We put 2 on each side. And the last strip I got is called a figure 8.
You don't feel like it prevents you from jumping or moving laterally at all?
Not really.
You know, for a parent to try to tape their child is probably not going to be a good thing. Probably get them one of those ASO ankle braces.
So what we're going to do here with Kyle here is just go through our biomechanical assessment to try to identify any areas where there might be weakness, tightness, muscle imbalance. We'd rather treat someone healthy than down the road 2 months from now they get injured, now they're in here trying to get something fixed.
Don't ignore those aches and pains, and even better, prevent them before they happen.
Exactly. So now we'll do a functional movement test and see if we found a couple little things that were maybe a little weak or tight in our initial assessment. I can go through and look at all the data and find out which areas were not optimal performance, and then I can go through and I can watch the videos of each of the movements, through the knee, through the hip, to the shoulder, that this is all in a good alignment. So Kyrie here has an injury to his foot, and you can see he has a cast on. But during this healing time, we want to make sure we keep the rest of his body in as good a shape as possible.
So the lesson is, anyone who's hurt at home, there's still ways to stay active. You just have to modify.
Exactly.
It hurts. Everyone thinks elite athletes are born, but you're really proving that it takes a lot of work along the way.
You know, they're all born with great athleticism, but it takes a lot more than that.
How many takes on those shots? You were on your game.
He got that his first try.
I took 50 shots to make 1. I'm kidding.